Welcome back to McClair and Port Huron's Today's Health, and we're talking today with Dr. Annette Mercatante about drug and substance abuse. Dr. Mercatante, what happens when in a person's body when they take opiates? What happens?
Well, so opiates attached to, we have opiate receptors in our bodies, and if you take too much of it, things like we talked about respiratory depression can happen, meaning you stop breathing. There is an antidote, I want to mention, to an opiate overdose. And by the way, opiates are Vicodins and Percocets and morphine. There's actually a long list of drugs that we consider opiate class. The antidote is a drug called naloxone, and trade name is Narcan. And what naloxone does is once it gets into your body, it knocks those opiates off the receptors so that they can start functioning better. It's very effective, it's very quick, and it won't harm you if you're having a problem from some other drug. It will only work for opiates, so it won't work for other drug overdoses. So naloxone is being increasingly promoted in our community as kind of a strategy for reducing harm from opiates. It's not a prevention tool, it's a prevention for death, from unintended death from opiates, but we're finding that more and more of our stakeholders are willing to carry it. We have it at the health department, free and available, including training for using it for anyone who has an opiate addiction or lives with somebody who has an opiate addiction.
Tell me a little bit about, you talked about tolerance and you talked about addiction.
Right.
How does that all go together?
So tolerance is a physiological effect of our bodies to an opiate, and dependence is another physiological effect. That means that our bodies become dependent on that drug to function normally. So when a person could be taking an opiate exactly as prescribed for exactly the right reasons, and over time this tolerance will develop and dependence will develop. That means when the drug is withdrawn, if you stop taking the drug, you'll go through a withdrawal. Physical pain, nausea, diarrhea. It's a very uncomfortable withdrawal from an opiate. It lasts at least a week. And so that's often a deterrent for people to stop these medications. Now, dependence in withdrawal doesn't signal an addiction. Addiction means a person is developing psychological, we call maladaptive behaviors to getting that drug. So they're starting to lie or do things that are outside of the normal scope of their behavior in order to continue to use that medicine. And that's addiction, and that has a whole nother level of need. So I want to make very clear that people who are taking opiates as prescribed and they have tolerance and dependence on it, that's a different problem than the addiction and the abuse that we're seeing in the community.
But both of those can actually result in a medical emergency.
Both of them can very, very much result in a medical emergency. They're both very complex problems.
What is the county doing to help deal with this?
So we identified the fact that St. Clair County seems to have a higher than average problem with this. So we compare our data, drug overdose deaths, and just utilization of opiates in general to neighboring counties or counties like us demographically, and we seem to have more of a problem. So we noticed that several years in a row, and so as a result we applied for some grant funding through the region, and we have put together, I think, a very vibrant and interested group. We call it the Prescription Drug Workgroup. We meet at the health department every fourth Monday at 10 a.m. Anyone's willing to come. And our goal is to develop a strategic plan for the community to try and develop preventive strategies and improve these issues. There's several layers to this. There's the people who already have problems with addiction and abuse, and there are resources, but there's not enough resources, as we know. And there's also way upstream the prevention side of this. What can we do for people so that they don't get into this trap? You can get addicted or certainly dependent on opiates with really no intention of doing so. So informing and educating the community, we need to make sure that we have other options for pain. Okay, it's a very easy thing to get a prescription when you're in pain, and pain's a terrible thing. But if the only option is to get a prescription for an opiate, we're putting a lot of people at risk. And so there's a lot of conversations and strategies we need to make, and that's what this work group is intended to do.
So let's talk a little bit about chronic pain, and because if you're in pain, you're going to
Important.
do what you can to get more
It's
comfortable
important.
so you can function.
Right.
So what are other options?
Well, there are lots of other options. There's the emotional side of pain, which is an important thing to consider. Not panicking and learning to calm your breathing and your response to pain. Now, I want to clarify, there's acute pain and chronic pain. Mm-hmm. So acute pain is like you burn your hand and you pull it away, and that's a defense mechanism for ourselves to survive, right? Chronic pain is a whole different mechanism. It's our body's responding to something inappropriately. So chronic pain is not necessarily the signal to tell us that something is desperately wrong. And that's up to your physician, your healthcare provider, to separate those two issues. It's very appropriate to use opiates for acute pain. Okay, when needed. I don't want to say it's not the correct option for all pain issues. But chronic pain is different. And chronic pain is defined as some people say more than 3 months, certainly more than 6 months of pain, where the pain is and it's not in proportion to the underlying injury, right? You know, you hurt your back in a car accident, and 5 years later you're still having excruciating pain. All the tissues healed up. Okay, so those kinds of pain issues require a much more diverse approach. Prescriptions are limited as far as what we can do. So there's mechanical modalities, there's physical therapy, we have chiropractic therapy, we have soft tissue modalities, we have lots of options, not to mention the psychosocial things of just trying to get your mind off of it. You can function with these things much better. Sometimes with a certain degree of pain, than trying to eliminate all the pain with an opiate. Functionality is important. So how well are you doing in your life? Are you getting to work? Are you enjoying your grandkids? Are you enjoying your life? And that's an important thing we have to consider when we deal with pain as well.
So what do you want people in the county to remember from our discussion today?
Well, mostly I want people to understand that this is a complex problem. Ask those questions when you see your loved one taking drugs, or particularly opiates. Make sure that you're asking the questions. Don't pretend that it's not a problem. Most people, when they're abusing drugs, are getting their drugs from friends and family or one doctor. Contrary, they're not necessarily going on the internet and buying them or getting them from a drug dealer from Detroit or Flint. That happens, but the vast majority, over 70%, are getting them from friends and family and loved ones. So when you get a drug, a prescription drug that can be abused, or as a controlled substance, we want you to lock it up. We don't want to just put it in your medicine cabinet and leave it there for 6 months or 2 years, okay? Lock it up, store it safely, and if you're done with it, get rid of it. I know that medications are expensive, but these are dangerous. They get in the wrong hands, and we want you to dispose of them, either a drug take-back, and we're developing community resources so that you can get rid of them within your own home. We don't want you to flush them, but you can take your medications and crush them and put them in kitty litter or coffee grounds so that they're no longer consumable, and then throw them in your garbage can. And that's the easiest way to get rid of them.
Thank you so much for joining us.
It's been my pleasure, Barb. Thanks for having me.
Stay with us. We'll be right back.